Hello again, students. This is the part 2 of our discussion in sexual self. Now let's talk about the STD or sexually transmitted diseases. So what do we mean by STD? The term sexually transmitted disease or STD is used to refer to a condition passed from one person to another through sexual contact. A person can contract an STD by having unprotected vaginal, anal, or oral sex with someone who has the STD. An STD may also be called a sexually transmitted infection or STI or venereal disease or VD. The STD are more easily passed on during unprotected sex. For example, without using safer sex options such as condoms or pag-sanitize dun sa mga sex toys if gumagamit yung isang individual nito, and many more, okay? But you have to remember that STDs are preventable. If you have sex, know how to protect yourself and your sexual partner from STDs. So what are the symptoms of STDs in men? It's possible to contract an STD without developing symptoms, but some STDs cause obvious symptoms. In men, common symptoms include number 1, pain or discomfort during sex or urination. Okay, may nararamdaman silang pain at the same time, hindi sila komportable during sex or urination kapag umiihi sila. Number 2, sores, bumps, or rashes on or around the penis, testicles, anus, buttocks, thighs, or mouth. Okay, and then there is also unusual discharge or bleeding from the penis. And last but not the least, painful or swollen testicles. But you have to remember also that specific symptoms can vary depending on the STD. Meron pa kasing iba't ibang types ng STD na later on madidiscuss natin sa mga succeeding slides. Okay? How about women? What are the symptoms of STDs in women? In many cases, STDs don't cause noticeable symptoms. When they do, common STD symptoms in women include first, pain or discomfort during sex or urination. Kapareho lang din sa may male. Then, there are also sores, bumps, or rashes on or around the vagina, anus, buttocks, thighs, or mouth. And there is also unusual discharge or bleeding from the vagina. And last but not the least, the itchiness in or around the vagina. Okay, and same with the symptoms of men, the specific symptoms can vary depending on the STD. Alright, moving on to the types of STDs. So, as we go on to our discussion, makikita nyo yung iba't ibang types ng STDs, okay? So, let's begin with chlamydia. What is chlamydia? It's the most commonly reported STD among Americans. However, this finding is only applicable in America. How about in the Philippines? If you still remember the answer of P words back during the Q&A in Miss Universe, she has mentioned the HIV condition in the Philippines. Ano yung sinabi niya roon? I will use my voice to influence the youth and I would raise awareness to certain causes like HIV awareness that is timely and relevant to my country, which is the Philippines. If I'm not mistaken, the most commonly reported STD in the Philippines is HIV or AIDS. And according to the website aidsdatahub.org, in January 2021, there were 890 confirmed HIV positive individuals reported to the HIV or AIDS and ART registry of the Philippines. And this is very alarming, okay? Kasi dumadami yung bilang ng HIV. Ang HIV, part yan ng STD or type siya ng STD. Okay? And many people with chlamydia have no noticeable symptoms. When symptoms do develop, they often include number 1, pain or discomfort during sex or urination. And there is also green or yellow discharge from the penis or vagina. And last but not the least, there is pain in the lower abdomen. What if hindi magamot itong chlamydia? If it is left untreated, chlamydia can lead to number 1, infections of the urethra, prostate gland, or testicles. Number 2, maaaring magkaroon ka ng pelvic inflammatory disease. And last but not the least, infertility. Okay? So, it's a condition in women where they cannot get pregnant. Okay? By the way, yung pelvic inflammatory disease, it is an infection of the female reproductive organs. So kapag hindi nagamot yung chlamydia, maaring mag-cause siya ng pelvic inflammatory disease or magkaroon ng infection sa female reproductive organ. What happens if a pregnant woman has untreated chlamydia? If a pregnant woman has untreated chlamydia, she can pass it to her baby during birth, and the baby may develop number 1, pneumonia, number 2, eye infections, and the worst thing is blindness. And you have to take note that chlamydia can infect both men and women. It can cause serious, permanent damage to a woman's reproductive system. This can make it difficult or impossible for her to get pregnant later on. Chlamydia can also cause a potentially fatal ectopic pregnancy. So what do we mean by that? It's the pregnancy that occurs outside the womb. Okay? An ectopic pregnancy happens when the embryo settles anywhere other than the womb's inner lining. Unfortunately, an ectopic pregnancy is fatal for the fetus. It cannot survive outside of the uterus, and this can lead to life-threatening complications. So there must be a quick treatment for an ectopic pregnancy to protect the mother's life. How can a person acquire this disease? You can get chlamydia by having vaginal, anal, or oral sex with someone who has chlamydia. If your sex partner is male, you can still get chlamydia even if he does not ejaculate. Now the question, if a person has been infected by this disease but he or she was already treated and cured, is there still a chance for him or her to acquire this disease? The answer is yes, okay? If you've had chlamydia and were treated in the past, you can still get infected again. This can happen if you have unprotected sex with someone who has chlamydia. Okay, so these photos are some of the evidences of people infected by chlamydia. Okay, yung reproductive organ ng male and female, ayan, and then kapag yung mother buntis tapos meron siyang chlamydia, maaring maipasa ito sa anak. Ayan, blindness nung sanggol. Next one, we have HPV, human papillomavirus. Okay, so human papillomavirus is a virus that can be passed from one person to another through intimate skin-to-skin or sexual contact. There are many different strains of the virus. Some are more dangerous than others. The most common symptom of HPV is warts on the genitals, mouth, or throat. So mag-attach na lang ako ng picture ng warts para magkaroon kayo ng idea. Okay? Some strains of HPV infection can lead to cancer, including oral cancer, cervical cancer, vulval cancer, penile cancer, or rectal cancer. Okay? There are still ways to at least protect oneself and minimize the harmful effect of this disease because HPV infections often clear up on their own. There is also a vaccine available to protect against some of the most dangerous strains. But you have to take note, my dear students, there is no guarantee that this disease can be cured by any medications. Okay? So according to some findings, 79 million Americans, most in their late teens and early 20s, are infected with HPV. It is most commonly spread during vaginal or anal sex. Just a trivia. You know what? According to the Centers for Disease Control and Prevention or CDC and the World Health Organization, the most common type of STD around the world, okay, around the world na ito ha, the most common type of STD around the world is HPV or human papillomavirus, with more than 600 million cases worldwide and 20 million in the United States. Okay? So what are the three most common STDs naman? Pag ito tinanong, ang isasagot nyo, HPV, chlamydia, and gonorrhea. Yung gonorrhea, madidiscuss din natin mamaya. Okay? Anyone who is sexually active can get HPV, even if you have had sex with only one person. Okay, take note, You can also develop symptoms years after you have sex with someone who is infected. Ang nakatakot sa disease na to is that it makes it difficult for a person to determine when he or she first became infected. Kasi nga, may mga instances na ang symptoms niya mapapansin lang or nagde-develop lang pagkatapos ng ilang taon after having sexual intercourse with your partner. Okay? This makes it hard to know when you first became infected. In most cases, HPV goes away on its own and does not cause any health problems. But when HPV does not go away, it can cause health problems like genital warts and cancer. I just want to emphasize this, my dear students, ha? This is a case-to-case basis. Yung ibang strains curable or pwede pang magamot at gumaling. However, some strains are not curable or hindi na kayang idaan pa sa medications. Okay? So these photos are some of the evidences of people infected by HPV. Ayan. What's next? We have syphilis. Okay, so syphilis is another bacterial infection. It often goes unnoticed in its early stages. The first symptom to appear is a small round sore known as a chancre. It can develop on your genitals, anus, or mouth. It's painless but very infectious. Later, symptoms of syphilis can include rash, fatigue, fever, headaches, joint pain, weight loss, and hair loss. What will happen if this disease is left untreated or hindi magamot or maagapan? If left untreated, late-stage syphilis can lead to loss of vision, loss of hearing, loss of memory, mental illness, infections of the brain or spinal cord, heart disease, and the worst thing is death. Ang kagandahan naman sa syphilis, kapag ito ay maagang naagapan, pwede pa siyang magamot with antibiotics. However, syphilis infection in a newborn can be fatal. That's why it's so important for all pregnant women to be screened for syphilis. Okay? Syphilis is divided into stages. We have primary, secondary, latent, and tertiary, with different signs and symptoms associated with each stage. A person with primary syphilis generally has a sore or sores at the original site of infection, and these sores usually occur on or around the genitals. Okay, so dun makikita yung sores dun sa kanyang genitals. Pwedeng sa may reproductive organ, sa may penis, sa may vagina, or around that area. And around the anus, sa may bandang puwit, okay, or in the rectum, or in or around the mouth. So, ito pinaka-visible sa mouth. And these sores are usually firm, round, and painless. Okay, hindi siya ganun kasakit. And then, symptoms of secondary syphilis include skin rash, swollen lymph nodes, and fever. Okay, yung signs and symptoms ng primary and secondary syphilis, mild lang siya. Hindi siya ganun ka sakit. Okay, and at the same time, hindi agad siya nanonotice or napapansin. Okay, and then during the latent stage, there are no signs or symptoms. How about kapag tertiary syphilis na? Tertiary syphilis is associated with severe medical problems. That is why kailangan na dito ng medical expert. So these photos are some of the evidences of people infected by syphilis. Ayan. Next STD is HIV. Okay? So, nagkaroon na kayo ng idea about HIV kanina nung na-introduce ko siya. Okay? So, what can HIV do to your body? HIV can damage the immune system and raise the risk of contracting other viruses or bacteria and developing certain cancers. What if hindi maagapan ng HIV? It can lead to a stage 3 HIV known as AIDS. But with today's treatment, many people living with HIV don't ever develop AIDS. Yun naman ang kagandahan. Okay? So, kapag na-reach mo na yung third stage ng HIV, hindi na siya kilala bilang HIV. AIDS na yung tawag natin dun. Okay? Surprisingly, with this disease, in the early or acute stages, it's easy to mistake the symptoms of HIV with those of the flu. So, hindi mo agad ma-determine kung symptoms na ba yun ng HIV or dahil lang sa flu. For example, the early symptoms can include fever, chills, aches and pains, swollen lymph nodes, sore throat, headache, nausea, and rashes. These initial symptoms typically clear within a month or so. But take note, from that point onward, a person can carry HIV without developing serious or persistent symptoms for many years. Other people may develop non-specific symptoms such as recurrent fatigue, fevers, headaches, or stomach issues. There is no cure for HIV yet, but treatment options are available to manage it. Early and effective treatment can help people with HIV live as long as those without HIV. You have to take note that HIV is not yet curable, although there are some medicines available to at least minimize its harmful effect to the body. Proper treatment can also lower a person's chances of transmitting HIV to a sexual partner. So basically, it's a win-win situation if someone got the chance to be treated. Kasi malolower yung chance niya na makahawa ng HIV sa kanyang sexual partner at the same time, pati siya, okay, gagaling. Human immunodeficiency virus or HIV and autoimmunodeficiency syndrome or AIDS are terms used interchangeably. However, HIV infection and AIDS are not the same condition and they are not the same diagnosis. When we refer to HIV, it's a virus that attacks a type of white blood cell called a CD4 cell in the body's immune system. It reduces the body's ability to fight infection and illness. However, treatment with antiretroviral therapy can minimize the effect of the virus by slowing or halting its progression. Treatment can now reduce the amount of virus in the bloodstream to levels where it is no longer detectable. This means the body remains healthy and the virus cannot be transmitted. On the other hand, when we say AIDS, my dear students, it is a syndrome or range of symptoms that may develop in time in a person with HIV who does not receive treatment. Remember this, tandaan nyo to. A person can have HIV without developing AIDS, but it is not possible to have AIDS without first having HIV. Kasi nga sabi natin, kapag ka may HIV ka at na-reach mo na yung stage 3, i-consider na yun as AIDS. Okay? So basically, magkakaroon ka muna ng HIV bago ka makarating sa AIDS. Hindi naman pwedeng nagka-AIDS ka nang hindi ka nagkaroon ng HIV. Ganun lang kasimple yun. Okay? So these photos are some of the evidences of people infected by HIV. Ayan. Next STD is gonorrhea. It is also known as the clap. Many people with gonorrhea develop no symptoms, but when present, symptoms may include number 1, a white, yellow, beige, or green color discharge from the penis or vagina. Ano say discharge? May mga fluid na lumalabas sa kanilang private part, okay, na iba ang kulay. And the next one, pain or discomfort during sex or urination. More frequent urination than usual, ihi sila ng ihi. And then itching around the genitals, may mga makati around dun sa kanilang private part. And of course, meron silang sore throat. Kapag hindi siya nagamot, gonorrhea can lead to infections of the urethra, prostate gland or testicles, pelvic inflammatory disease, and infertility. Possible bang mahawa ang baby kapag ang mother ay may gonorrhea? The answer is yes. It's possible for a mother to pass gonorrhea to a newborn during childbirth. When that happens, gonorrhea can cause serious health problems in the baby. That's why many doctors encourage pregnant women to get tested and treated for potential STDs. Yun naman ang pinaka-importante, okay? Para ma-determine natin kung infected ba ang asawa or di kaya ang partner sa kahit anong STD na meron dito, okay? And ang gonorrhea kasi wala yang pinipiling kasarian. It can infect both men and women. It can cause infections in the genitals, rectum, and throat. It is a very common infection, especially among young people ages 15 to 24 years old. Okay, so sila yung target nitong disease na to. Nagre-range from 15 to 24 years old. So, paano nakukuha yung ganitong disease? You can get gonorrhea by having vaginal, anal, or oral sex with someone who has gonorrhea. Some men with gonorrhea may have no symptoms at all. However, men who do have symptoms may have burning sensation when urinating. Okay? And a white, yellow, or green discharge from the penis and painful or swollen testicles. Although, this is less common. Okay? Very rare lang yung ganitong symptoms, okay? Most women with gonorrhea do not have any symptoms. Wow, surprisingly, diba? Even when a woman has symptoms, they are often mild and can be mistaken for a bladder or vaginal infection. Okay, so napagkakamalan lang siyang bladder or vaginal infection kapag meron silang symptoms nitong gonorrhea. Women with gonorrhea are at risk of developing serious complications from the infection even if they don't have any symptoms. So these photos are some of the evidences of people infected by gonorrhea. Ayan. Next, we have pubic lice or kuto. Crabs is another name for pubic lice. They're tiny insects that can take up residence on your pubic hair. Katulad lang din ng kuto sa may buhok ng tao and even sa body, ang pubic lice, they also feed on human blood. Common symptoms of pubic lice include itching around the genitals or anus, may pangangati na nararamdaman, small pink or red bumps around the genitals or anus, medyo namumula or may pinkish. Okay, dahil nga sobrang kati, nakakamot siguro, okay? And then low-grade fever, lack of energy, and last but not the least, irritability. Hindi kayo mapakali, naiirita kayo, okay? A person might also be able to see the lice or their tiny white eggs around the roots of pubic hair. So, possible na makita nyo kung meron kayong pubic lice. Paano ang gagawin nyo? Kailangan nyo lang ng magnifying glass, okay? Which will help you to spot the pubic lice, okay? O what if hindi magamot or hindi mapaalis itong mga pubic lice dun sa inyong private part? Pubic lice can be transmitted to other people through skin-to-skin contact or shared clothing, bedding, or towels. Scratch bites can also become infected kapag kinakamot ng kinakamot. It's best to treat pubic lice infestations immediately. Actually, this type of disease is curable pa rin naman. You can use over-the-counter topical treatments and tweezers to remove them from your body. It's also important to clean your clothes, bedding, towels, and home. So basically, practice proper hygiene para ma-avoid natin yung ganitong type ng STD. Okay? Ganito ang itsura ng pubic lice. Ayan. So, mai-spot nyo sila or makikita nyo rin naman sila kapag gumamit kayo ng magnifying glass. Okay? Next is Trichomoniasis. Okay, so what is Trichomoniasis? It is also known as trich. Okay, it is caused by a tiny protozoan organism that can be passed from one person to another through genital contact. When symptoms do develop, they may include discharge from the vagina or penis. Kanina ko pa sinasabi yung word na discharge. When you say discharge, may fluid na lumalabas sa kanilang private parts, sa vagina or sa penis. And then burning or itching around the vagina or penis, pain or discomfort during urination or sex, and frequent urination. In women, trich-related discharge often has an unpleasant or fishy smell. Sa mga babae, kapag infected sila ng disease na to, may lumalabas na fluid sa kanilang vagina and most of the time, mabaho yung amoy. Okay? If it is left untreated, trich can lead to infections of the urethra, pelvic inflammatory disease, and infertility. Although symptoms of the disease vary, most people who have the parasite cannot tell if they are infected. Okay? So, trichomoniasis is more common in women than in men. Older women are more likely than younger women to have been infected with trichomoniasis. Okay, so ang target nito is mga jutanders or mga matatandang babae. Okay? So, the photo evidences of people infected by trichomoniasis. Ayan. And for the last STD, we have herpes. Okay, so herpes is the shortened name for the herpes simplex virus or HSV. There are two main strains of the virus, HSV1 and HSV2, and both can be transmitted sexually. Anong meron sa HSV1? The HSV1 primarily causes oral herpes, which is responsible for cold sores. However, HSV1 can also be passed from one person's mouth to another person's genitals during oral sex. When this happens, HSV1 can cause genital herpes. How about the HSV2? The HSV2 primarily causes genital herpes. Kung yung HSV1 is oral herpes, yung HSV2 naman is genital herpes. The most common symptom of herpes is blistery sores. In the case of genital herpes, these sores develop on or around the genitals. In oral herpes, they develop on or around the mouth. Okay? So, dun makikita yung symptoms. Kapag HSV1 sa mouth, kapag HSV2 naman sa may genitals or dun sa may private part. Okay? Herpes sores generally cross over and heal within a few weeks. The first outbreak is usually the most painful. And then yung outbreaks, habang tumatagal, nagiging less painful na siya or hindi na siya ganun kasakit. Okay? If a pregnant woman has herpes, she can potentially pass it to her fetus in the womb or to her newborn infant during childbirth. This so-called congenital herpes can be dangerous to newborns. You have to take note there is no cure for herpes yet, but medications are available to help control outbreaks and alleviate the pain of herpes sores. The same medications can also lower your chances of passing herpes to your sexual partner. So, photo evidences of people infected by herpes. Ayan. Sa mouth and then sa kanilang genitals or sa private part. Usually dyan makikita. Okay, yung HSV1 and HSV2. Okay, so moving on to STDs from oral sex. You have to remember, my dear students, vaginal and anal sex aren't the only way STDs are transmitted. It's also possible to contract or transmit an STD through oral sex. In other words, STDs can be passed from one person's genitals to another person's mouth or throat and vice versa. Oral STDs are not always noticeable. When they do cause symptoms, they often include a sore throat or sores around the mouth or throat. Surprisingly, many STDs are curable, maaari pa siyang maagapan at magamot. For example, the following STDs can be cured with antibiotics or other treatments such as chlamydia, syphilis, gonorrhea, crabs, and trichomoniasis. However, others can't be cured, hindi na pwedeng magamot. Okay? For example, the following STDs are currently incurable as of now. We have HPV, HIV, and herpes. Okay? Moving on to the treatment of STDs. The recommended treatment for STDs varies. Of course, it depends on what STD you have. It's very important that you and your sexual partner be successfully treated for STDs before resuming sexual activity. Otherwise, you can pass an infection back and forth between you. Okay, so kailangan manggamot muna yan bago kayo ulit magkaroon ng another sexual intercourse. Okay? Next part is bacterial of STDs. What are your actions if you are infected by such STD? Usually, antibiotics can easily treat bacterial infections. It's important to take all your antibiotics as prescribed. Continue taking them even you feel better before you finish taking all of them. Let your doctor know if your symptoms don't go away or return after you've taken all your prescribed medication. And we also have the viral STDs. It's also important to remember that antibiotics can treat viral STDs. While most viral infections have no cure, some can clear on their own. And in many cases, treatment options are available to relieve symptoms and reduce the risk of transmission. Ang STDs kasi or sexually transmitted diseases or STI, sexually transmitted infections, are either viral or bacterial. Yung pinresent ko kanina sa inyo na bacterial and ito na viral. A viral infection is caused by a virus and cannot be cured. Hindi na siya magagamot. On the other hand, ang bacterial infection is caused by bacterial organism and the active infection can be cured. Yun naman yung pinagkaiba nila. Okay? So, ayan. Avoiding sexual contact is the only foolproof way to avoid STDs. But when having vaginal, anal, or oral sex, there are ways to make it safer. That is why on the succeeding slides that I will present to you, we will talk about methods of contraception and family planning. Okay? Ayan. So, let's talk about responsible parenthood, family planning, and RA number 10354. The information on family planning and contraception is for everyone, even for those who are still in their adolescent years. To be educated on family planning and contraception is to be protected from STD and unintended pregnancies. So what do we mean by responsible parenthood? Responsible parenthood is the will and the ability of parents to respond to the needs and aspirations of the family and children. Basically, it means that each family has the right and duty to determine the desired number of children they might have and when they might have them. And beyond responsible parenthood is responsible parenting, which is the proper upbringing and education of children so that they grow up to be upright, productive, and civic-minded citizens. What about family planning? Family planning is a program that enables parents to deliberately and responsibly decide the number and spacing of their children. It is an expression of responsible parenting based on informed choices and decisions of couples based on their social and economic capacity. The family planning programs intend to provide accessible information on sexual and reproductive health for people to choose from depending on their needs and preferences. So bakit naman inimplement itong family planning? Maternal mortality, unplanned pregnancies, and unsafe abortions are among the effects of poor family planning. Moreover, modern families are failing to sustain the adequate needs of their growing number of children, which is also an outcome of poor family planning and low use of contraception. Hence, the family planning program aims to ensure every Filipino has a universal access to correct information, medically safe, legal, effective, and culturally acceptable modern family planning methods. Since we are talking about family planning and contraception, might as well include the RA 10354 or RH law. Okay, so we have Responsible Parenthood and Reproductive Health Act of 2012. It is a law which guarantees universal access to methods of contraception, fertility control, sexual education, and maternal care. Allow me to give a short background of this law. The Philippines passed the Responsible Parenthood and Reproductive Health Act of 2012, also known as RH law, after 14 years of waiting. So, ganun katagal. The Philippines gave funding for free or subsidized contraceptives at health centers and public schools. The government passed the RH Act in response to the many health issues impacting the country, such as infant mortality, pregnancy-related deaths, and a rise in HIV or AIDS cases. Moreover, teen pregnancies in the Philippines are common, where 9% of women between the ages of 15 and 19 start childbearing. Lack of knowledge about reproductive health is significantly associated with poverty, especially in regard to overpopulation. Therefore, the RH Act aims to help the population make informed decisions about their reproductive health. It provides more equal access to sex education, while also ensuring that the government reaffirms its commitment to protecting women's reproductive rights, providing accessible family planning information, and hiring skilled maternal health professionals to work in both urban and rural areas of the Philippines. However, this RH law is considered as one of the most controversial bills in the Philippines. You know why? Kasi tutol ang simbahang katoliko na ipasa itong bill na ito before. For your information, around 80% of the Philippine population identifies as Roman Catholic. Accordingly, the Catholic Church largely influences the state of sex education in the country. The Catholic Church opposes sex outside of marriage and fears that sex education will increase sexual relations. Additionally, the Catholic Church opposes implementing sex education in schools as well as the distribution of contraceptives. The Church prefers to rely on parents to teach their kids about reproductive health. However, many families are either unequipped to do so or will not address the subject directly with their children. Eventually, itong RH bill naging law naman na siya, naipasabatas na siya under the term of President Benigno Aquino. Okay, 2012 na ipasa ang RH bill. RH law na siya ngayon. Okay, so in terms of methods of contraception, it is categorized into three. The first is the old methods, second is traditional or natural contraceptives, and the last one is modern contraceptive methods. But before I proceed, of course, we have to define contraception first. Birth control, also known as contraception, anti-conception, and fertility control, is a method or device used to prevent pregnancy. Birth control has been used since ancient times, but effective and safe methods of birth control only became available in the 20th century. So let's start with the old methods contraception. Ang ginagawa ng mga Chinese women before, umiinom sila ng lead or mercury para ma-prevent yung pregnancy or hindi sila mabuntis. And then, yung herbs, olive oil, ginger, tobacco juices ay iniinom din ng ibang kababaihan before to kill the semen at para hindi rin sila mabuntis. Okay? Ang ginagawa naman ng mga French prostitutes, they use acidic douches. Ang ginagawa nila rito is they wash and clean out the inside of their vagina with water or other mixtures of fluids. Surprisingly, ang ginagawa ng mga Greek women, they jump 7 times backward after ng sexual intercourse para hindi sila mabuntis. Okay, so moving on to the next category, the traditional. Okay, so first is periodic abstinence. Okay, so under periodic abstinence, we have calendar or rhythm method and cervical mucus. So periodic abstinence is also known as fertility awareness and rhythm method. Paano ito napiprevent ang pregnancy? This approach entails not to have sexual intercourse on the days of a woman's menstrual cycle when she could become pregnant. From the word abstinence, ibig sabihin pag-iwas. So, to make it simple, pansamantalang pag-iwas sa pakikipagtalik kung ang babae ay fertile. Kasi kapag nataon na fertile ang babae, sa time na nakipagtalik siya, malaki ang chance na mabuntis siya. Okay? So, we have calendar or rhythm method. The rhythm method, also called the calendar method or the calendar rhythm method, is also a form of natural family planning. To use the rhythm method, the woman tracks her menstrual history to predict when she will ovulate. Ang mga babae kasi, they are most fertile at the time of ovulation. If you can still recall what we have discussed in part 1, yung ovulation period, wherein it happens when an egg is released from ovaries. Sa mga girls dito, makinig. Your ovulation period usually occurs 12 to 14 days before your next period starts. Take note, this is the time of the month when you're most likely to get pregnant. If you're hoping to get pregnant, you can use the rhythm method to determine the best days to have sex. Similarly, if you're hoping to avoid pregnancy, you can use the rhythm method to determine which days to avoid unprotected sex. Okay, kaya nga siya tinawag na calendar. Ibe-base mo dun sa calendar kung kailan ka fertile and unfertile. Remember, using the rhythm method for birth control requires careful record keeping and persistence. If you don't want to conceive, you and your partner must avoid having sex or use a barrier method of contraception during your fertile days each month. Actually, same thought goes with cervical mucus. The cervical mucus method kasi, it's a way for women to identify their fertile times to help them gauge the best days to have or avoid unprotected sex. Okay? And then letter B, we have withdrawal, also called coitus interruptus. Basically, this is ejaculation outside the vagina, kaya sila tinawag na withdrawal kasi sa labas ilalabas. Okay? What if you forgot to bring a condom and you want to use the withdrawal method? What is best withdrawal method? Gentlemen, listen carefully. For withdrawal to work as well as possible, you must always do it right every single time. So always pull out before ejaculation and always make sure to ejaculate away from your partner's genitals. This is important because pregnancy can still happen even a little bit of semen gets in the vagina. Okay, so walang assurance kahit sa withdrawal. Kaya kailangan maayos yung labas. Okay? However, this is not a very reliable way to prevent pregnancy because of high failure rate due to pre-ejaculation. Next is lactational amenorrhea method or LAM. Okay, so this is contraceptive method based on breastfeeding. Lactation amenorrhea method is a way for breastfeeding to temporarily help prevent pregnancy. It must be used correctly to work, and this is effective up to 6 months after childbirth. And last but not the least, this is exclusive breastfeeding and menstrual cycle not yet returned. Okay, so lactation means your body is making breast milk and amenorrhea means you are not having a monthly period. Para mas magets nyo, ito yung question na feeling ko gusto nyo ring malaman. How does breastfeeding prevent pregnancy? When you exclusively breastfeed, meaning you breastfeed at least every 4 hours during the day and every 6 hours at night, your body naturally stops ovulating. Take note, you cannot get pregnant if you don't ovulate. Remember this, breastfeeding hormones may stop your body from releasing eggs. No ovulation means you won't have your period or menstruation. Moving on to the modern contraceptives. First, we have hormonal methods. It works by preventing the ovary from releasing an egg, thickening the cervical mucus, making it difficult for the sperm to reach the egg, and changing the lining of the uterus, making implantation difficult. So what are the examples of hormonal methods? We have pills or birth control pills, injectable, and implants. So isa-isahin natin sila. Of course, yung pill or yung birth control pills, taking the pill is the same as taking other tablets or medicines. Yung gamot na tinitake natin, ganun lang yung pills. And then yung injectable naman, the contraceptive injection is a shot that contains hormones, either a progestin alone or a progestin and an estrogen together, that stop your body from releasing eggs and thickens the mucus at the cervix. So parang yung bakuna lang din natin sa COVID, ganun yun, injectable. Okay, so sa pagpapa-inject ng ganitong contraceptive, you need one shot either once every month or once every 3 months from a healthcare provider. The way it works is similar to the pill. Yun nga lang, ang kagandahan dito, hindi mo na kailangang alalahanin everyday na may iinumin ka pang pills or may iinumin kang gamot. Okay? Kaya lang itong injectable, para lang to dun sa mga malalakas ng loob na babae. Okay? Kasi kung takot ka sa needles or takot ka dun sa karayom, then definitely baka hindi mo siya magustuhan. Okay? And next one is implants. What is the birth control implant? Birth control implants are devices that go under a woman's skin. They release a hormone that prevents pregnancy. So, paano nagwo-work itong implants? Once the implant is placed under your skin, it releases small amounts of etonogestrel. The hormone works on your pituitary gland, which tells your ovaries not to release eggs. Okay? And aside from this, it also makes the mucus in your cervix thicker, mas kumakapal siya. And this makes it harder for sperm to get to any eggs that are released. Now, the question, gaano ka-effective itong implants para ma-prevent yung pregnancy? Actually, hormonal implants work more than 99% most of the time. Okay? How about yung injections naman? 94% ang kanilang effectivity na ma-prevent ang pregnancy. Yung pills naman, yung pag-take ng pills, 91% yung effectivity nito. But you have to remember that none of these methods protect you from STD or from sexually transmitted diseases. Only condoms prevent STDs. Tandaan nyo yun na, condom lang ang makakapag-prevent na mag-spread yung STD or sexually transmitted diseases. Kahit mag-take ka ng mga to, ang mapiprevent lang nito ay pregnancy, hindi STD. Okay? Ayan, so we have here yung phases, okay, sa babae. We have dry face, sticky face, creamy face, clear face. So kapag day 1 to day 3 after ng inyong period, yung fluid na lumalabas, ibig sabihin nun, dry face siya, not fertile. Okay? Not fertile kayo nung time na yan. And then, day 4 to 6, not fertile pa rin kayo. Okay? And then, sa day 7 to 9, semi-fertile na kayo sa days na to. Okay? Kaya siya nanawag na creamy face. And for days 10 to 14, fertility or fertile na kayo sa moment na to. Okay? So, may tendency na kapag nagkaroon ka ng sexual intercourse with your partner, mabubuntis kayo. Okay? Okay, next we have barrier methods. Basically, barrier methods prevents pregnancy by blocking the egg and sperm from meeting. Unfortunately, barrier methods have higher failure rates than hormonal methods due to design and human error. Of course, hindi na maiwasan na may mga lapses, may mga pagkakamali sa ganitong mga devices. Okay? So, isa-isahin natin. First is spermicides. Spermicide is a contraceptive substance that immobilizes or kills sperm before they enter the uterus. This single-use applicator contains a spermicide gel. Yung spermicides, ini-insert yan sa vagina ng babae just before the sexual intercourse. And next one, we have male condoms. Surprisingly, with the use of condom, aside from preventing pregnancy, it can also protect you against sexually transmitted infections. So, double purpose kumbaga. Okay? Familiar naman na kayo sa condoms ng lalaki. Next, if you're wondering if females do also have condom, the answer is yes. Female condoms are a barrier method of contraception worn inside the vagina. Of course, they prevent pregnancy by stopping sperm meeting an egg. Okay, and then next one we have diaphragm. A contraceptive diaphragm or cup is a circular dome made of thin, soft silicone that inserted into the vagina before sex. Ang ginagawa ng diaphragm, it covers the cervix of the female so sperm cannot get into the womb to fertilize an egg. Okay, and then next one, cervical cup. The cervical cup is also a birth control device that prevents sperm from entering the uterus. Surprisingly, the cervical cup is a reusable. Ang cervical cup kasi, it's a silicone cup that is inserted into the vagina and fits tightly over the cervix. And for the last one, we have intrauterine devices or IUD. Ang IUD kasi, it's a small T-shaped plastic and copper device that is put into your womb. by a doctor or nurse. It releases copper to stop you getting pregnant and protect against pregnancy for between 5 and 10 years. It is sometimes called a coil or copper coil. So basically, ang purpose naman ng mga to is to prevent pregnancy. Okay? Kung mapapansin nyo, lahat sila same ng function. Okay? Iba-iba lang sila ng design, iba-iba lang sila kung paano gamitin. Okay? Ayan. So, yung sa first image, ito yung spermicides. Yung sa may upper left portion. Okay? Ayan yung nasa gitna, ito, condom ng lalaki. Ito naman yung condom ng babae, yung may sa may upper right corner. Okay? And then this is diaphragm. Para lang siyang cup na maliit na i-insert sa vagina. And then the cervical cup. Almost same sila ng style ng diaphragm. And ito yung IUD. Para siyang T-shape or letter T. Okay? Na ini-insert sa babae. Okay? Next, we have emergency contraceptive. So, it must be taken within 72 hours of the act of unprotected intercourse or failure of contraception method. Okay? Ang nangyayari kasi, pag intake ng emergency contraceptive, it floods the ovaries with high amount of hormone and prevents ovulation. So, kung nakalimutan mong gumamit ng barrier methods, pwede kang gumamit ng emergency contraceptive. Okay? And it alters the environment of the uterus, making it disruptive to the egg and sperm. Now, the question, can one get pregnant after taking emergency pills? Actually, itong morning after pill, aka emergency contraceptive or contraception, can help prevent pregnancy when you take it after having unprotected sex. However, it won't prevent pregnancy for any sex you may have after taking it. Okay? And for the last one, we have surgical methods. Ayan. So, it involves surgical procedure to prevent fertilization of the egg. So, we have tubal ligation and vasectomy. So, yung tubal ligation, it is also known as having your tubes tied or tubal sterilization. It's a type of permanent birth control. So, during tubal ligation, the fallopian tubes are cut, kinakat talaga, or tinatali, or blocked to permanently prevent pregnancy. So, kahit nag-undergo ang babae ng tubal ligation, the procedure does not affect her menstrual cycle. Okay? And for the last one, vasectomy. Vasectomy is a surgical procedure for male sterilization or permanent contraception. During the procedure, the male vas deferens tube are cut and tied or sealed so as to prevent sperm from entering into the urethra and thereby prevent fertilization of a female through sexual intercourse. With no sperm leaving your body, you cannot get someone pregnant, but you can still have an orgasm and ejaculate. Okay? Ayan. So, yung sa may left portion, ito yung tubal ligation. And then, yung sa may right portion naman, ito yung vasectomy. Okay, so that ends our lecture for the part 2 of Sexual Self. I hope you have learned something today. Again, this is Sir Marvin telling you that you should never stop learning because life never stops teaching. Thank you so much for watching. Have a good day ahead. Goodbye, everyone.